Hello everyone, welcome again. As we previously promised, we're going to show some interesting cases from now on every week, and this is the first interesting case. I want you guys to look at this for some minutes and then we will go over the findings. So the question is, what is the most likely diagnosis? Is it aberrant carotid artery, carotid aneurysm, persistent trigeminal artery, or fetal type PCA? Okay, I hope all of you got the correct answer. Let's go through the findings. So first of all, I would like you to tell you what type of imaging is this. This is a head CT, yes, but it's a contrast enhanced head CT or arterial phase head CT. And how do I know? Because we see these all skull-based vasculature are very bright. So that shows that this is a CTA with arterial timing in the CT technique. So basically, in order to answer the question, we have to look at the vasculature at the skull base over here. So here we know that this is the carotid canal, comes over here, we have cavernous carotid, and then I'll go here, and then when it comes back, it's going to be carotid terminus. So basically, here we're going to see mostly the cavernous carotid bilaterally here. And then here I see the tip of the basilar artery, and what it shows here, there is an artery that is just connecting the basilar artery to the cavernous ICA. So basically, this is the cavernous ICA, this is the basilar tip, and this is the vascular channel that is connecting these two arteries together. So normally, we shouldn't have any connection between posterior circulation, which is consistent of basilar artery and posterior cerebral arteries, and anterior circulation usually comes from the internal carotid artery. So they shouldn't have any connection between them besides posterior communicating artery. But here we have aberrant artery that's communicating the ICAs to the basilar artery, which is basically called persistent trigeminal artery, which is a congenital variant. Regarding other choices, so aberrant carotid artery, we are not showing it here. Aberrant carotid artery should be a little bit more lower. That basically over here we are just going to see some variant anatomy. So it's not aberrant carotid artery. It's not a carotid aneurysm. Sometimes we might look at this and thinking, okay, this might be a little bit aneurysmal, but this is a vessel that is just turning on its own. So this is a basically fake out. This is not an aneurysm over here. And fetal type PCA, basically, it means the posterior circulation. When we have a P1 segment and PCA, of the PCA, we have most of the posterior circulation basically getting more feeding from the ICAs. So basically, it means the posterior communicating artery is larger and is more stronger than the P1 segment of the PCA. So that's what it means by fetal type PCA, which is not the case here. So basically, as I mentioned, we are seeing the connection between anterior and posterior circulation, which is a variant anatomy, persistent trigeminal artery, and is a very common board type question for radiology resident. Just make sure that pay attention on this and make sure to be familiar on this appearance, also angiograms. Thank you for your attention. Please let me know what type of cases you would like to see in the comments. And if you enjoy seeing these type of cases, please like and subscribe to basically go further. Thank you.